Hey, welcome to the Memorizing Pharmacology podcast. We're going to be starting the critical thinking activities in Chapter 2 of Nursing Pharmacology. And what I wanted to do is show you where all of these videos and audio are going to be. So here is the Nursing Pharmacology book, and what I've done is I've put it at memorizingpharm.com. And if you go to the front page, I know that this is a little bit small because this is what it would look like on mobile. And it's just click here for the OER nursing textbook, videos, and audio, which will take you to this page. And here we have all of the links that you need to Memorizing Pharmacology, Memorizing Pharmacology Mnemonics, and the Nursing Pharmacology textbook. And here are the kinetics and dynamics. This is where you would find all of those videos. So this Kinetics and Dynamics Chapter 1 button here will take you to the videos. So we had Video 1, Video 2, and Video 3, or Part 1, Part 2, and Part 3. All right, and the nice thing is that it's not really hard to figure out where this is because it's memorizingpharm.com, OER 1, and then Chapter 2 will be OER 2. And so eventually I'll record the entire chapter readings. Again, this will take some time, so that will all be here for you. So right now we're kind of going one chapter at a time, and now we're going to hit Chapter 2. Okay. All right, well, our first critical thinking activity is here at 2.2a. I'll read it to you, and then I will give you a detailed response. So critical thinking activity 2.2a, a nurse is preparing to administer medications to a patient while reviewing the chart. The nurse notices two medications with similar mechanisms of action have been prescribed by two different providers. What is the nurse's best response? Well, first I'm going to give you my answer, and then I'll show you another resource on the Memorizing Pharm webpage that can really help you here. So when you look at two similar medications with mechanisms of action, for example, maybe both of them reduce heart rate, well, we could make the patient bradycardic, or both increase heart rate and make them tachycardic. And so the first thing is to clarify with both providers that, letting them know that we have this duplicate, because they may not know that the other person's doing it. And this is not uncommon for someone to go to their primary care physician, get a prescription, and then go to maybe their cardiologist and get another prescription, and only to find out that the cardiologist and primary care physician are not really communicating, and that we have some kind of duplicate or something like that. So what I want to do is take you to two web pages on the website. The first one is memorizingpharm.com/drug prefixes and suffixes. This suffix and prefix list allows you to find a number of the medications and their suffixes. And these are the suffixes from Memorizing Pharmacology, the first edition, just 200 medications. And for example, we can look in here and we can see that Prazole is an anti-ulcer agent. But when we go to immune, okay, there's aconazole, okay, that is a systemic antifungal, okay. And in neuro, we see piprazole, which is a psychotropic. And when we know those suffixes and prefixes and all of those things, what it does is it makes that a lot easier to catch those medications which are the same class or same mechanism of action in this case study. The other prefixes and suffixes list I have is the one where it's a PDF. It's memorizingpharm.com/drug suffix PDX, so DRUGSUFFIX PDF. And this is a 60-page long document. So if you really want the big one, this is it. And this has 800 drugs. Now, this is a little bit of overkill, but if you're trying to look up something, then you would go in here. It's a searchable document. Makes it a lot easier for you to find it. Much more comprehensive. But in terms of usability, I might use the one before it. But when we're talking about same mechanism of action, if we see the same endings, then we're going to have the same mechanism of action likely. Okay, but you have to kind of go a little bit into the weeds, because if you have, for example, esomeprazole and omeprazole, well, you actually have two proton pump inhibitors, and both of the physicians were thinking, hey, I want to reduce this patient's gastric acid. One gave them one medication and the other one gave them the other, and they both didn't mean to give the same type of medication. But if a patient is on, let's say, omeprazole and fluconazole and aripiprazole for a GI issue, an immune issue, well, it's an antifungal, and then we're also talking about an antipsychotic, then, well, we may have physicians that all three want to write those medications, and those are not duplicates. But that, again, is what the Memorizing Pharmacology books are all about, making sure that you can not only understand, memorize the medications, but also increase your patient's safety. Okay, so that was 2.2a. Maybe I went a little bit too deep into that one, but the bottom line is same mechanism of action you want to clarify with both prescribers. Here is Critical Thinking Activity 2.2b. Okay. A nurse is preparing to administer metoprolol, a cardiac medication, to a patient and implement the nursing process. Assess the vital signs prior to administration and discovers the heart rate is 48, so patient is bradycardic. Diagnoses that the heart rate is too low to safely administer the medication per the parameters provided. Establishes the outcome to keep the patient's heart rate within the normal range of 60 to 100. So again, below 60 is bradycardic, above 100 is tachycardic. Plans to call the physician, as well as report this incident in the shift handoff report. Implements interventions by withholding the metoprolol at this time, documenting the incident that the medication is withheld, and notifying the provider. Continues to evaluate the patient's status throughout the shift after not receiving the metoprolol. The nurse is providing patient teaching to a patient about the medication before discharge. The nurse provides a handout with instructions, as well as a list of current medications. What other information should be provided to the patient? Well, here what we're going to do is we're going to make sure to let them know, hey, when you need to take the medication, what kind of side effects you're going to watch out for, and adverse effects. And then maybe there's diet, over-the-counter restrictions, herbal supplement restrictions as well. But let's just give one. So with beta blockers, one of the things that is maybe a little bit of a surprise is something called exercise intolerance, where all of a sudden patient goes home, tries to exercise, and is like, whoa, what is going on? I just do not feel like myself. That's something they should know before they go home with the medication, that, okay, that's going to happen with a beta blocker that will reduce, heart rate very, sometimes significantly. And that's kind of one of the things that should be in there. The other thing is to make sure that you're looking at the patient. So if the patient is diabetic, okay, beta blockers mask the signs and symptoms of hypoglycemia, because normally a hypoglycemic patient would get a rapid heart rate and kind of get tremors and those types of things. And if that's not the case, then the patient might not realize that they're hypoglycemic. So that's another one of the counseling points to put in there. So that kind of tiredness that a patient might feel is going to be somewhat normal with a beta blocker, especially at first. And then if a patient's diabetic, want to make sure that they know that the signs and symptoms of hypoglycemia might be covered up. All right, critical thinking activity 2.3a. Levofloxacin is an antibiotic that received FDA approval. However, the drug was on the market. It was discovered that some patients who took levofloxacin developed serious irreversible adverse effects such as tendon rupture. The FDA issued a black box warning with recommendations to reserve levofloxacin for use in patients who have no alternative treatment options for certain indications: uncomplicated UTI, acute exacerbation of chronic bronchitis, acute bacterial sinusitis. A nurse is preparing to administer medications to a patient and notices that levofloxacin has been prescribed for the indication of pneumonia. There's no other documentation in the provider's notes related to the use of the medication. What's the nurse's best response? So we'll give you a second. since this is not one of the normal indications, we're going to want to first clarify that the prescriber, whether nurse practitioner, physician, whatever, really meant to give levofloxacin for this patient. That's the first thing we're going to do. And then we want to make sure that we document that. Then, if it is a go-ahead, then we want to make sure we tell the patient, okay, take the levofloxacin with water, make sure you take it at the same time each day. You can take it with or without food, but the patient should be told that they need to avoid dairy products like milk, yogurt, things like that, at least 2 hours before or after, because it will chelate or bind with those types of things and make it much less effective. It'll also bind with things like antacids, calcium carbonate, and magnesium hydroxide, aluminum hydroxide. And I didn't want to go into the weeds with that, but the idea is that multivalent cations, multivalent, again, this is why chemistry is so important. So multivalent means it's +2 or +3, multi meaning many. And so if you look in group 2 of the periodic table, group 3 of the periodic table, in group 2 you see calcium and magnesium, and in group 3 you see aluminum. And so if you see those are going to bind with the levofloxacin or fluoroquinolones more generally, and they're going to make them ineffective. So that's if you get the go-ahead from the prescriber. Okay, let's go on to critical thinking activity 2.3b. A nurse is providing discharge education to a patient who has recently had surgery and has been prescribed hydrocodone with acetaminophen tablets to take every 4 hours as needed at home. The nurse explains that when medication is no longer needed, when the post-op pain subsides, it should be dropped off at a local pharmacy for disposal in a collectible receptacle. In a collection receptacle. The patient states, "I don't like to throw anything away. I usually keep unused medications in case another family member needs it." What is the nurse's best response? All right. Well, the first thing is we really don't want to share medications. It is illegal, especially with the controlled substance, like something like hydrocodone with acetaminophen, which is Vicodin, or Lortab. Because not only does the other patient, we don't know what other issues they might have. For example, let's say that for patient has trouble breathing or just something like that. You can have respiratory depression if you take too many of these. So what we want to do is talk about the dangers of the potential drug interactions, dietary interactions, other side effects of the medication for themselves, where the prescriber and the nurse have already looked at their record. But to give a medication to someone and you haven't even evaluated the other medications, that would be irresponsible. In this case, also illegal. Let's do number 2, or part 2 here. A nurse begins a job on a medical surgical unit. The charge nurses on this unit is highly regarded by her colleagues and appears to provide excellent care to her patients. The new nurse cares for a patient that the charge nurse cared for on the previous shift. The new nurse asks the patient about the effectiveness of the pain medication documented as provided by the charge nurse during the previous shift. The patient states, "I didn't receive any pain medication during the last shift." The nurse mentions this incident. The preceptor states, "I've noticed the same types of incidents have occurred with previous patients, but didn't want to say anything." What is the new nurse's best response? Well, this is the issue where we may have an impaired nurse, and this could obviously endanger the patient and themselves, to be honest. So it's their obligation to report the suspected drug use to the nurse manager and supervisor, and then in maybe some cases to the board of nursing. But if that happens, And certainly if it happens on a consistent basis, then it's not to take it on your own. It's to talk to the right people about this and, kind of go from there. All right, critical thinking activity 2.3c. A nurse is preparing to administer morphine, an opioid, to a patient who recently had surgery. Number 1, explain the 5 rights that the nurse will check prior to administering this medication to the patient. Number 2, outline 3 methods the nurse can confirm patient identification. 3, what should the nurse assess prior to administering this medication to this patient? 4, what should be monitored after administering the medication? 5, what should the nurse teach the patient and or family member about the medication? 6, what information should be included in the shift handoff report about this medication? All right, well, let me reread the question each time I do this, just because there's a lot of pieces to this. So number 1, explain the 5 rights that the nurse will check prior to administering this medication to the patient. So number 1, the 5 rights are right patient, right medication, right dose, right route, right time. And then, of course, we're going to want to make sure that, we check the expiration date and, we check allergies. Although it's not on here, a 6th right is correct or right documentation as well. Okay. All right, the second question said outline 3 methods the nurse can confirm patient identification. So let's kind of break this up. You could scan a barcode on the medication and the patient's armband, if they have it. You can ask their name and date of birth. Okay. You could just check the armband itself or the identification band. But sometimes you're going to be in settings like long-term care, and there might not be an armband. And also, if you're talking about dementia patients, they may not know their name or date of birth. So what we want to do is maybe, if the medication record has an image of the patient, that would be one way to do it. But probably the best way is to get somebody that is working there as well and say, I think this is such and such, or just say, look, I know who I think this person is. I just want you to identify them to match it, so that you don't already say, hey, this is this person. The person says, yeah, that's that person. What we do in the pharmacy is we'll generally ask for somebody's address, and that's just an innocuous way of saying, okay, we have the same person. So Tom Smith, we're just hoping that Tom Smith and Tom Smith don't both live in the same place or in the same address. And even if they do live in the same building, like we're in some place like New York where you could have, many, many people living in the same building, making sure to pay attention to the apartment number or something like that. Okay. All right. What should the nurse assess prior to administering this medication to the patient? So we weren't really that specific. We just said it was some kind of opioid, so we know that there's going to be some issue with pain. So what's the patient's pain level? Are they conscious and alert? What's their respiratory rate? Again, we know that an overdose of opioids can reduce the respiratory rate, cause respiratory depression. And then are they oxygenating? Okay. So what do we do then if there is respiratory rate that's decreased, or an oxygenation level that's decreased, or sedation is too high? We want to make sure that we contact the prescriber, talk about withholding the medication, things like that. And then, of course, if there's some kind of overdose, definitely want to start talking about interventions. Number 4, what should be monitored after administering this medication? Well, again, we're monitoring respiratory rate, that oxygenation level, are the sedation status, and then, is it effective in treating the pain? Is it doing its job? Okay. Number 5, what should the nurse teach the patient and or family member about the medication? So this would be the common side effects, and we're not talking about toxicity. We're talking about, Patient's probably going to be constipated, and this would be a good time to check the medication record to make sure that maybe there's some docusate sodium on board or something like that, some degree of laxative that's going to help them, or a stool softener. And then let them know that drowsiness is going to be something that does happen, but also to maybe let them know, okay, well, what are the signs of toxicity, where we would be going kind of a little bit further than the common side effects. And then the sixth one was what information should be included in the shift handoff report about this medication. So again, we're talking about the pain. Where is that pain coming from? What's the pain level? What medications were given, and what times during the shift? And then, how did the patient respond? Is the patient comfortable? Is the patient doing well? All right, let's go on to 2.3D. Okay. A nurse is disciplined by the Wisconsin Board of Nursing for an incident reported by her employer that she arrived to the shift intoxicated. The nurse shares with a nursing colleague, "I love taking care of patients. I work so hard to obtain my nursing license. I don't want to lose it. I know my drinking has gotten out of control, but I don't know where to turn." What is the best advice by the nursing colleague for this patient with a drinking problem? Well, most boards are going to have some level of assistance. So in Wisconsin, you'd have a professional assistance procedure where the patient that's committed to recovery is able to get that treatment and support. And what we want to do is we want to, again, prioritize patient safety. But also, we also want to acknowledge that the nurse has rights as well to get help, especially if she's committed to that kind of recovery. All right, we are in question 2.4. A nurse is providing education to a mother regarding a liquid antibiotic prescribed for her child to take at home. The prescription states amoxicillin 250 milligrams, 1 teaspoonful, 5 mLs every 8 hours for 7 days. After talking with the mother, the nurse realizes the family does not have measuring spoons in their home. What is the nurse's best response? So this is a really common thing that happens, especially when maybe you have a spoon that gets lost, or someone just forgot the medication itself. If you go to any pharmacy, they'll give you a syringe. You don't have to, do I need to pay for a syringe? I mean, you could buy one, but just go up to the counter. Hey, can I just get a measuring spoon or a syringe? Now, to be fair, the syringe is actually a bit more, I don't want to say it's necessarily more accurate, but the data show that patients do better with the syringe than they do with the measuring spoon in terms of giving the appropriate dose. So going to a pharmacy to get this, don't try to use the spoons at home, the tablespoons, the teaspoons. That is not the way that you want to do it, to make sure that the patient, especially a child, gets the right medication. All right, well, we're in our last section. We're going to do two more. Critical thinking activity 2.5a. The nurse is performing medication reconciliation for an elderly patient admitted from home. Patient does not have a medication list and cannot report the names, dosages, and frequency of the medication taken at home. What other sources can the nurse use to obtain medication information? In this case, what we're going to do is we're going to try to compile everything for them. Often, in the pharmacy world, we'll have brown bag events where the patient just kind of brings all their medications, including over-the-counter stuff. We don't want to exclude that. We don't want them to just bring prescribed medications. And what we want to do is make sure that we kind of compile them into a list that we can print out for the patient, so that the patient, when they go to their next provider, can provide this list to them. Again, the medications will change and things like that, but making sure that all the medications are correct and appropriate, that we don't have medications they were using before they don't need anymore, and then making sure that they go home with a list. All right, critical thinking activity 2.5b. So nurse is preparing to administer insulin to a patient. Nurse is aware that insulin is a medication on the ISMP list of high alert medications. What strategy should the nurse implement to ensure safe administration of this medication to a patient? So, of course, we're going to use the 5 rights. We're going to want to make sure that the blood glucose level is where we want it to be. What type of insulin are they taking? Concentration. When was it opened? So we want to make sure that it's good. And then also what kind of storage was happening with the medication. The nurse should, can draw the dose. They can confirm the correct dose with another nurse prior to giving it. And then knowing the onset, peak, and duration of action to monitor for potential side effects, like hypoglycemia, which is quite common with insulin, unfortunately. But let me show you a page of memorizing pharmacology so that you can kind of see where memorizing some of these insulins would be really useful. Okay, when you're looking at this and you're working on memorizing these, you want to memorize them in order, some kind of order. In this case, with insulin, you want to memorize the rapid acting, those that start working in 15 minutes, last about 4 hours. Those are going to work so quickly, you've got to make sure that the patient has a meal. So we're talking about insulin Lispro or Humalog, something like that. Short acting works in about 30 minutes, and this is lasts about 6 to 8 hours, and this is regular insulin, Humulin R. The intermediate NPH, Humulin N, about an hour or two, lasts 14 to 24 hours. And then that long duration insulin, Glargine, Lantus, and Toujeo, those start working about an hour and last about 24 hours. But when you memorize them, you want to remember Humalog, then Humulin R, then Humulin N, then Lantus or Toujeo. We want to do that in order, put them in your brain in order, because then when you're saying, okay, I'm giving insulin, if you're giving Humalog, okay, well, I've got to talk to the patient about what they were eating. With R, that there's maybe some kind of titration up or down where maybe we're kind of looking at their blood glucose first and then giving R. NPH would be given to kind of control insulin levels over a much longer period of time. And then certainly insulin Glargine, are we giving it at nighttime or daytime? Which time are we kind of choosing to do that? So my advice is when you get to that insulin, that insulin can be life-saving, but it can also be very dangerous. Memorize them in order: Humalog, Humulin R, Humulin N, and then Lantus or Toujeo. And just to be clear, this is the book that I'm talking about. It's right here, Memorizing Pharmacology, a Relaxed Approach, 2nd edition. And this was the Kindle version. The audiobook obviously is going to narrate those types of things, but I just want to make clear this is where this is coming from. All right, well, let's kind of go back to the beginning here. So again, this was a nursing pharmacology lesson. This was chapter 2, legal and ethical. And the next thing we can do is go into antimicrobials, which is chapter 3. And I'll talk a little bit about the way that I teach and the way that I put them in order. I always put my classes, and then I ask I ask the students to always put their groups in order. So they would put gastrointestinal, musculoskeletal, respiratory, immune, neuro, cardio, endocrine. I ask them to always put the medications on the patient's med list in that order so that they can look for duplicates and things like that. And then when they're studying for NCLEX, NAPLEX, whatever it is they're studying for, to also continue to study in that order so that in your brain you kind of have these partitions, and okay, the first partition is GI, the second partition is musculoskeletal, the third partition is respiratory, because I think it gets confusing when you use multiple books or multiple resources and you're in a different order. But so if you need my help or want to get in touch with me, TonyThePharmacist@gmail.com. Hope you've enjoyed this episode and hope it's been helpful.